I rise to support this particular bill that has been presented by the Senate. I've also gone through the report that has been provided by our Parliamentary Budget Committee. And clearly, the observation therein has been occasioned by the austerity measures that have been caused by a standing down of the bill 2024-25. So it simply means there is a big hole in that particular budget, and this has caused the county allocation to be reviewed downwards from 46.6 to 61.9 billion. This indeed is a big hole. Honorable Speaker, when you look at the additional allocation to our counties, are monies that are provided by development partners from many areas: water, health, urban development, sanitation. And all these are very different facets that addresses the basic human necessities in those counties. But also, the government does what you call matching fund. These monies, from my understanding, although they are allocated to the counties, the National Assembly or the Senate does not have a clear purview of how these funds are utilized, how they are oversighted. Is it directly from the ministry or directly from the department or institution that gives the money? Who indeed oversees this fund? Because it doesn't form the mainstream part of the budget allocation to the county. For that reason, I think going forward, we as the National Assembly, we must protect the national coffers, and we must make sure that funding to the counties is timely, it is efficient, but also those funds must be efficiently utilized from those counties. Although it is the Senate that oversees the counties, but the people who live in those counties live in constituencies. And those are people, and it must be of concern to us. Article 95, Sub-Article 1, matters of concern to the people. Honorable Speaker, some of the areas that I see the committee has recommended is to decline things like transfer of museum functions from the national government to the counties. One of the difficulties we are seeing is the human capital that obtained in our counties, where a lot of technical issues fail to be done and funds are allocated. And when you are giving things like museums, where you need the curators, the researchers, scientists of different levels of expertise will look after museum. So if we just say because of funding, let us give this function to the counties, then we may be killing the goose that lays the golden egg. Because around the world, a major tourist attraction, a major contributor on the side of tourism fund is museums. So for that reason, I support what the committee has advised, in terms of museums. Secondly, it is the issue of county aggregation and industrial parks. Our Vision 2030 envisions that Kenya will be a middle-income country, industrialized. So having industrial park in counties, although we cannot do all of them in one hog, is really important. But when you look at the allocation of 105 million to the different counties, it simply means we are chipping slowly to give these counties edge. But I would rather, in my submission, let us say, for example, we establish the industrial parks in Isiolo first. Then we go to the next county, the next year, part 1 financial year. So that these industrial parks, if you don't put in enough money, eventually they'll just be white elephant. Funds have been put, there isn't enough fund to complete it. And also counties may not have enough funding for this particular project. Finally, Honorable Speaker, it is the issue of community health promoters. This is the first line of community health workers of preventive rather than curative. These are some of the initiatives that we have borrowed from other jurisdictions or other countries. And a good example is Cuba, where the community health promoters are the ones that have a clear view on what are the sort of common elements in the communities, and it is dealt with first line through health, through improving water, through improving health checks. By the time the individual goes for curative, then it simply means that the first line has not worked. And it has been seen that Cuba health system is very well organized, and it is among the best in the world. So for that reason, we must look at financial allocation to the community health promoters, most probably with the chipping of allocation to this particular area. Then it means we may downsize a lot of youngsters who are working in this area. It is something that we must remain seized so that communities are really not disadvantaged to a great extent. With those many remarks, Honorable Speaker, I beg to support.